You know, millions of people deal with mental health issues on a daily basis, and getting proper help you want to be sure that you have qualified people working with you. Well, here at the Gulfport Behavioral Health System, they work with them on a daily basis and are well trained in doing that. Stephen East is Director of Business Development. How are you doing, Stephen?
I'm good, Jim. How are you doing?
I'm doing great. Give us a little background, if you would, about the Gulfport Behavioral Health here.
Okay, so Gulfport Behavioral Health as a building has actually been here since 1984. It's been through a couple of different owners. It's now Gulfport Behavioral Health System. It's been that way since 2018. We have 90 inpatient acute beds, and we see anywhere from adults up to 100, let's say, down to children as young as 4 years old.
Wow.
Yeah, and it's primarily an inpatient facility, but we also have an intensive outpatient programming as well. That would be a partial hospitalization program, where you would come full-time, just during the day, usually 8 to 3:30, and it usually lasts 2 to 3 weeks, for 5 days a week. Mm-hmm. And then you can step down into what we call an IOP, an intensive outpatient program, which is a part-time outpatient program. And it's 2 or 3 days a week, and you may come for 3 to 5 hours a day, depending on, if it's 2 days or 3 days. And that usually lasts 4 to 6 weeks. And then from there, you'd step back into society, you'd see a traditional counselor, maybe you would go to a physician for medication management. But we're really proud of the things that we do here for our inpatients as well as our outpatients. Every patient who comes here, you can walk in our front door. We're here 24/7, 365. We have a no-cost mental health assessment.
Oh, wow.
So you can walk in the door, get your mental health assessment, and depending on where you fall there, you could be inpatient, you could fall into that partial hospitalization population or the intensive outpatient population. But we let you know where you need to be, where you need to go, and then we get you those resources. From a therapy perspective here, every single patient is looked at on an individual basis. What are your experiences? What issues are you having? And we use evidence-based therapies to make a plan for each patient, and we make sure that they flow through that plan. They develop the coping skills, the distraction skills, whatever that is that they need to move forward and help them get on that path of mental wellness.
Now, Cynthia Render-Leach is the Human Resources Director here at the Gulfport Behavioral Health System. How are you?
I'm doing great.
Tell us a little bit about yourself, the job that you do here, and what kind of person does it take to work here in the behavioral health?
Very good. I've been in healthcare for going on 30 years, and this has been the first experience that I've had with mental health. I've been in other acute care facilities, but the foray when it comes to mental health is a little bit different experience here for our patients. This is a freestanding behavioral health facility. We're caring for patients as young as 4 all the way through adults. And it takes special people to be in healthcare, but in particular when it comes to mental health, our patients have very unique issues. In many cases, they're not visible. We don't know, when they come to us for assistance because it's not something that we can see or understand maybe right away. The kind of patients that we have, unfortunately, are kind of the most vulnerable people, and they present to us as though that they're actually needing assistance. Most of them come to us voluntarily. Our patients need people to take care of them while they're here that are dedicated and compassionate. It is important for us to find those people that can connect to people on an individual level. They want to be part of a team that's a therapeutic team in the treatment and the care of our patients. So we seek out those individuals that are committed to delivering the type of patient care that is high quality. Those are ethical people. We know that when they come to us, they're going to get the best care possible from our team members.
That's awesome.
So we have a great team. We have wonderful nursing staff, techs that are dedicated. They're the eyes and the ears of our nursing team, our social workers, case managers, our medical staff, psychiatrists. It's definitely a team approach. So the folks that actually come to work with us have that kind of a mindset, that they're willing to be part of a team. We're always looking for new team members, great people that are wanting to dedicate their lives to their patients.
Matter of fact, we want to meet a couple of those wonderful people right now. Now, Sean Chaska is a registered nurse. Brent Guy is one of the techs here. And tell me, Sean, if you would, why do you work in mental health?
Okay, so this may be a cliche answer, but I mean, I love people. I love patients, and I think the mental health has really gotten a bad rap. Here, you got mamas and daddies, you got brothers and sisters, and you got your children, your sons and your daughters. And I think they all deserve the most respect and have this big heart and this caring heart, and I just want to love people and let them know that they're important. And that's what we do here, along with all the other staff. I mean, you've got to love mental health to love these patients, and we love them.
And that you've got all the characteristics that Cynthia was talking about a while ago that they look for in employees. So that's absolutely awesome.
Thank you.
Thank you very much.
Thank
Appreciate
you.
it. Brent, tell me what it is that why you work in mental health.
Well, pretty much for the same reasons that Sean said. I grew up watching documentaries on mental health, and as early as the 90s, there were people that were just like shoved into a hospital and forgotten about just because they had some sort of mental disorder. And we want to bring it to the forefront. You know, I do care about my patients. I've cried with them, I've laughed with them, I've hugged them. I don't think that they get the respect that they deserve, quite frankly, and I want to try to change the perspective of how people view mental health.
I think that's one of the great things, again, that the characteristics that you both have. One of the main things, compassion. You have to have compassion.
Yes, sir.
All right. Thank you all very much. Thank you
You're
for all the
welcome.
great work you're doing.
Thank you.
Stephen, this is an amazing place. It really is. I mean, from the services that you provide, the employees that you have, the ones that we've talked to, and there's so many others that are running around here, smiles on their faces. If someone wants to get the services here, you know, need some treatment, what do they do?
First of all, thank you. I think our employees are the best. They definitely have a compassion for what they do every day. In order to come and get an assessment, no cost assessment, you can walk through the front door. You can call and schedule an appointment, 800-831-1700. You can go to our website, it's gulfportbehavioral.com, and we can set you up on a no cost assessment, and we can find a way to help you. When we do those assessments, Jim, just so you know and everybody else knows, nobody leaves here without having some kind of a plan. If you don't need inpatient treatment, we want to make sure that you know what your next option is, even if it's an outpatient counseling, and we'll give you that list of counselors that you can look at.
All right. I appreciate it. Stephen East,
thank you.
Appreciate the Business Development Director here at Gulfport Behavioral Health System. They're on Highway 49 in Gulfport, just on the north side of the post office as you're going north on Highway 49. You need help? Give them a call.